It's another day with the physicians where your health is our business. The growth spot the end. So you are not going to take some drastic measures. But a 10-year-old tummy, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what is low?
You're welcome back to the training of your regular program.
So I had to pick from here and there. Give me 10, give me 20. I just bought potato. And the women will be like, we are not here for food.
Autism spectrum disorder, or autism, is a broad term used to describe a group of neurodevelopmental conditions. These conditions are characterized by differences in non-verbal communication and social interaction. People with autism spectrum disorder often demonstrate restricted and repetitive interest in patterns or behavior. Autism spectrum disorder is found in people around the world regardless of race, ethnicity, culture, or economic background. The abilities and needs of people with autism spectrum disorder vary and can evolve over time. While some people with autism can live independently, others have severe disabilities and require lifelong care and support. People with autism spectrum disorder are often subject to stigma, discrimination, and human rights violation. We will be discussing the causes, presentation, diagnosis, and management of autism with our expert today on your favorite TV health talk show, The Physicians. It's another day with The Physicians where your health is our business. Today we'll be talking about autism. I'm sure so many people have been hearing about this word, autism. Actually, it's a broad term that is used, that is characterized by so many things. It's a spectrum, actually. But then, my name is Dr. Martina Agbere. I'm not alone on this program. I have with me my regular...
I remind Dr. Memuna Yusuf Kadri, it's always a pleasure to be on set with you because in the physicians, your health is our business.
We're discussing autism today. And, you know, it's a broad term.
Spectrum disorders.
Actually, yes, it is. So what it means is that we have the different ranges.
Yeah.
And maybe the one that is closer to the beginning is usually different from the one that is towards the end, because it's a broad spectrum, right?
Yeah. Aside from the fact that it's a broad spectrum, it's just, you know, with the different way it presents, the characteristics, and it has one of it has a gender difference. So,
well, let's not dwell more because we have the expert that's going to come and just talk more about it. So don't go, we'll be back after this short break. Stay tuned. have just joined us, you're on to your regular program, The Physicians, where your health is our business. Today we're discussing autism, the predisposing factors, the risk factors, the causes. Why are some people known to have autism? Well, in the studio today we have our guest. She is a consultant pediatrician. She runs the Pediatric Neurology and Neurodevelopmental Clinic, the unit of the very known Massive Children Hospital here in Lagos. She is no other person than Dr. Zainab Opoola. Welcome to The Physicians.
Thank you, Dr.
Nice to see you.
Thank you
welcome,
very
Dr.
much.
Zainab. It's good seeing you again. You know, I have a soft spot for those that call Zainab.
Because
Zainab is my daughter.
yeah. Anyway, she's actually looking really pretty like your daughter. I've seen her before. So, Dr. Zainab, let's go straight to why we're here now, talking about autism. Do you just want to give us an overview? What is autism? Give us a general overview.
Okay, thank you, Dr. Martina. So now, autism is described now as autism spectrum disorders because before there were several conditions. We had the pervasive developmental disorder, Asperger's syndrome, but now they are all grouped under autism spectrum disorder. But to describe what autism is, it's a disorder of it's a developmental disorder that is characterized by impairment in social communication or interaction and restricted repetitive behaviors and interests. So those are two major categories. Before there used to be three, but now there are two. So it's either you have a problem or not a problem. Either you have an impairment or difficulty with social communication and interaction, or you have some restricted repetitive behaviors. So even under the group of restricted repetitive behaviors are what we called response, either hyper response or hypo response to sensory stimulation. I know these words are sounding, very big. Yeah, so let me just try to break it down. So for social communication and interaction, that's pretty straightforward. Trying to express yourself or trying to even understand instructions and carrying them out. So because communication can be expressive or receptive, or even non-verbal communications, or trying to share emotions, trying to share excitement, trying to share anger and all that. So it can be verbal and it can be non-verbal. So for instance, a child sees an experience, maybe sees a lion, or no, let me use common animals, sees a cow on the road. That's very strange. And most children will be like, mommy, cow, like they'll draw you, and they want to share that experience with you. So a child on the spectrum may see the cow, can demonstrate some, but it's very difficult for him to draw the attention of someone else to share that experience with him or her. So that's one of the examples. Then even non-verbal communication, like, okay, I want this cup, a child normally children, especially the infants or toddlers, will point to the cup, or mommy flower, they'll point to it. But children with autism would rather drag the mom to the cup. That's a way of saying, that's what, but you should just point to it and say, I want this, so, but they will drag because they can't really express, so they have that problem with social communication and interaction. Then the second category is the restricted. So, they ask this question, does he have ritual behaviors? Does he like doing something repetitively or in a particular manner? Or likes a particular item and it has to be arranged in a particular way. Those are some ritualistic behavior, or even some repetitive not really purposeless movements. Like now, a child can wake up and just likes turning around the circle, and I'm wondering, why are you spinning around this? But he's comfortable doing that, and it's an example of repetitive or behavior. Then restricted is not being able to have this imaginative thinking. So as children, children act this play, being able to imagine, oh, I'm a princess, I'm in the garden. Yes, play, I'm feeding you. This, your mommy, your daddy. it's difficult for them to actually be that imaginative and play those kind of roles. Then the last on the hypersensory, hyposensory. So in trying to stimuli that is necessarily normal to every other child can be so much or too little for a child with autism. Okay, so for example, a child with autism can be in a room and just the normal conversation may be too loud, and the child just do like this, like it's too loud for me.
Wow.
So that's like hyper
Sensitive.
yes to that.
Are they usually withdrawn?
Well, I'll still go back to being withdrawn. So the hyposensory, on the other hand, they can be making so much noise. A lot of noise can be in a room, and the child is just comfortable.
As if I don't know what is happening.
Yes, just comfortable in it. That's to sound. So sound is the stimuli. It can even be to touch. It can be to skin. So they might not like the feel of
them.
or the feel of a certain material on their skin, maybe wool. Just take it off. They don't like the feel. Or some even to taste. So some don't like rough things in their mouth. They'll just prefer it smooth.
Wow.
So those are some examples of how they respond to certain stimuli. Then going back to being withdrawn, well, there are various. So children with autism, some of them, not all, they just like to be by themselves. They like to play by themselves, just be by themselves, and not necessarily interact with other children. So those are some of the behaviors or some of the characteristics of children with autism.
Two-pronged question. Because children living with autism they didn't develop themselves. So we are going to look at the parental side. Could it be any reason, a risk factor why parents will have children with autism, and what are the known causes?
Okay. Well, that's this cause question. I've heard it so many times, and well, I'll try to explain what has been known now. So there are predisposing factors, and predisposing factors, there are some certain genetic conditions that predispose. So you can have there are some genetic abnormalities in children that might not be so obvious. The child might not really look different, but there are some subtle genetic abnormalities that are high predisposition for autism. Those genetic, they are not really obvious looking, but by the time you run those genes, you notice, one or two things are not supposed to be where they are. Then if there is a family history, actually,
so a parent can have a child with autism and another one with autism.
Exactly. There is a higher chance of having a second sibling with autism when one of the siblings have autism.
That's not interesting at all.
Yeah,
at all.
It is not. It is very sad.
If you look at it, they are cost.
Yes.
It is very, and I have seen patients. I have not one, not two siblings.
And it actually cause friction in marriages.
Marriage, yeah.
Yeah, so another predisposition, so children small for age, some people associate being prematurity to a predisposition of having autism later in life, congenital infections to, those problems that happened in the first trimester might predispose to having autism. But a straightforward cause and effect has really not been established, because there are some children that everything was fine, was born at term, no infection, and by the time you even do the genetic screening, everything might come out clean, and they have those behavioral concerns. So for that, we just say we don't know what might have caused that. Yes, so those are some of the predisposing factors that can predispose children to having autism.
Thank you very much, Dr. Zainab. When we come back, we need to just keep a date with others out there that are actually are talking about keeping a date with the physicians. When we come back, we're talking about the diagnosis. I'm sure viewers out there, you are enjoying what I'm also enjoying here, but we need to hear from you what you have to say about keeping up the physicians and autism. We'll be back after this short break.
From my layman understanding, autism is a mental disorder detected early in the child from 3 months to 3 years.
I think it's a kind of defection that affects children, their psychomotor skills. They are not able to behave like normal children. They find it very difficult to work with, I think, their nerve system also. They are not able to move their hands properly. They are not able to do things the way normal children do. Jaundice, I think I've heard about that too. When you take the child through some series of transfusion and probably he's able to come out of that sickness. Sometimes they have that issues of autism.
The causes of autism at times is environmental factors, and they've not been able to detect whether it's hereditary, but mostly it's environmental factors. As a social disorder, it tends to, be to himself more, and at times by stacking his toy continuously the same way each and every time.
The awareness has to be very, very much improved. Just like the time we had AIDS and we had Ebola, so many things went out to create awareness. I think we also need to create awareness for autism cases.
Welcome back. If you have just joined us, you're on your regular program, The Physicians, where your health is our business. Today we're talking about autism. And the studio here, our guest, Dr. Zainab Opoola. She's a consultant pediatrician and also a pediatric neurologist. She runs a neuro clinic in the Mercy Children's Hospital and also in charge of the neurodevelopmental clinic. She's been talking about autism, and she's been doing justice to this particular topic. Before we went on break, she told us about the telltale signs, what the parents should look out for. So now we want to talk about the diagnosis. How do you make a diagnosis? Because you listed, the spectrum. How are you able to make a diagnosis for parents to know?
Okay, so diagnosis is actually clinical. It is a strictly clinical diagnosis. So what do I mean by clinical? Information from the parents, what they've observed, and even the doctor physically observing the child and just observing the child in his or her natural environment. However, we have some, tools, some screening tools, but even those tools are ways we are asking questions, or we are assessing what the child can do or how the child responds to some of our assessments. So it's basically clinical. You don't need to do a brain scan or to test your blood for you to know exactly.
And some of them have even gone to see the ENT doctor.
Yes, but that's part of it's part of the evaluation, because we need to exclude. Yes, we need to be sure the child can hear. No, we always do that as routine. So to register hearing is intact. So no, that is part of the evaluation. But to make the diagnosis, to key that diagnosis of autism is usually clinical. However, if we are thinking something might predispose, for instance, if we are thinking this genetic screening, genetic abnormalities, you might want to just run the genetics to see what genetic abnormalities involved, and it can be associated with other things too. So if you get the history that, doctor, aside from these behavioral issues, my child also sometimes shakes his hand, because they are associated with epilepsy too sometimes. So you might need to do a test for that, an EEG, to make sure to rule out epilepsy, or even from the history alone that can also be picked. So the bottom line is a clinical diagnosis. Other tests might just be done to look for the cause or to rule out comorbid conditions.
So now we've talked about, red flags, causes, signs and symptoms, and of course, even making the diagnosis on this is it, autism, and this is what we can actually really narrow down to. Our audience want to know, how do we now manage this? Because this is a child with special needs now, obviously. What do we do in terms of schooling? What do we do as parents to look, care for this child? What do we do in terms of feeding? What do we do?
Thank you, Dr. Wibuna. So yes, that's usually the question I get. And so, doctor, what next?
Yeah.
You've made the diagnosis. What next? It is also a multidisciplinary approach. One person can't do it all. So you need the help of several people. The pediatrician makes the diagnosis and tries to anchor the care. Another person that is very relevant is what we call the behavioral analyst. Yes, so the behavioral, because the child will need behavioral therapy. You know, the child will need how to. So you are teaching the child, or you are training the child how to express his or herself. It might not be verbally, but even non-verbal ways of expression. So the behavioral therapist usually works hand in hand with the speech therapist, so they work together. But I always key that behavioral before, because most parents say, speech. I know speech is a problem, but behavioral, then the speech therapist. Then they'll also, so for schooling, depending on the severity of how severe it is, or because like Dr. Memuna says, there are some that are actually very intelligent, so they can be in a mainstream school, they can be in a proper school, but they might just need these people to help them in school, to guide them in school, to make them stay still, listen to instructions and all. So depending, they need like an individualized learning plan. So they are assessed, their strengths and weaknesses are identified, and a learning curriculum or a plan is designed for that child. So sometimes these behavioral therapists come to school to help out. Sometimes they can do the extra learning at home and all. But if there's now associated severe intellectual disability with autism, if the intellectual disability is severe, we can now program like a learning plan that is suitable for that child's intellectual quotient.
Okay.
So it's actually an individual, like every child is different. So depending on the needs of the child, what the child require will be different. And they also need occupational therapy, because some of them might have problem holding on to things, even if because they're autistic, so they need the help of those people. Then therapy, counseling, psychologists for the parents is also very important, because the diagnosis is quite heavy, and to go through the period for them to be able to stay strong all through, it's very necessary.
Okay, before I let you go, as a consultant pediatrician and a pediatric neurology and neurodevelopmental experts, you come in contact with these patients. How often, how common is it, number one, and why is awareness important? Why is awareness important?
Okay,
how common and why is awareness important?
Well, from the studies that were done in Nigeria, the prevalence study was still quite low. That was scientifically saying about 1% in 1% out of about 1% of children were found, which is, we like say low, which is still low. It's still working. Yes, but how common? Because I'm veered towards that specialty. I see many children with autism, but on a bigger scale, it's still like 1%. So the second question, why is awareness important? Awareness is important because the earlier we realize, the earlier we can intervene.
That's exactly what I want to hear from you. The earlier we realize, the earlier we intervene. I'm sure viewers out there, you have heard it from the consultant herself. The earlier we realize, the earlier care is given, and the prognosis is usually better. And again, autism is not life-threatening. We can live with it. The children can live with it. So we just need counseling, we just need support. Family support, community support. Let us support them. My name is Dr. Martina Agbere, and next time, same time next week, ensure you keep a day with us on The Physicians, where your health is our business.
Please ensure that if you or a loved one, relative has a child living in autism, try as much as possible to shower them with love and care. Get them to the hospital, like what the doctor said. It's a multidisciplinary approach, not a one-size-fits-all. They can be cared for. They can also fulfill their destinies right here on earth. I remain Dr. Memuna Yusuf Kadri, and please endeavor to follow us on all our various social media platforms. And if you would like to be a part of the program, you are just a click away. Till next time, stay blessed.
Hi, my name is Dr. Eugene Wosu, consultant cardiologist and chief medical director of United Heart Hospital in Lagos, Nigeria. So stay tuned and continue watching The Physicians, and you're going to learn a lot about how to take care of yourself and your loved one.